Well, good afternoon and happy American Heart Month, everybody. My name is Lara Bryn, and I'll be serving as your MC today. I am the afternoon and evening anchor at CBS 6 in Albany, New York, and I'm really happy to be a part of this event. I MC'd the Heart Ball last year, and I'm MCing it again on Friday night, so I saved my red dress for Friday, so there you go. Thank you for joining us for the Check It Challenge community conversation, How to Manage Blood Pressure, presented by Baxter, the Kinney Drugs Foundation, and Central Hudson Gas and Electric. The Check It Challenge is an evidence-based 4-month wellness and blood pressure management program that focuses on improving your health by making simple changes to prevent and manage high blood pressure. Broadview Federal Credit Union is a proud sponsor for the Check It Challenge. Be sure to also join the 28-day Journey to Better Health Paths to help you achieve your health priorities. These journeys provide you with daily emails and reminders with small tips and nudges to help you make the changes that you want. Choose from manage blood pressure, eat smart, or move more. Start your journey at www.heart.org/checkitny. Today's session is the first in a series of monthly webinars that will be offered throughout the 2025 Check It Challenge. Organizations and individuals are encouraged to sign up and learn more again at that same website. So that's www.heart.org/checkitny. The Check It Challenge is proudly sponsored by Broadview Federal Credit Union, Baxter, the Kinney Drugs Foundation, Central Hudson Gas and Electric, and media sponsor CNY Latino. So thank you to our sponsors. At the American Heart Association, February is American Heart Month, but we're also celebrating Black History Month. During Black History Month, we celebrate the rich heritage and resilience of African American communities, while also highlighting and addressing pressing health disparities, particularly in cardiovascular health. Through culturally relevant outreach, partnerships, and community support, the association is dedicated to fostering health equity and reducing the disproportionate impact of cardiovascular conditions in Black communities. By building strong partnerships with organizations such as the Divine Nine, D9, and Black churches, we can bring impactful heart health education to people where they live, work, and worship. Heart disease is the leading cause of death among Black adults, and hypertension affects Black Americans at some of the highest rates in the world. Black or Hispanic adults who experience cardiac arrest outside a hospital setting are substantially less likely to receive life-saving care from a bystander. You're going to hear from some amazing speakers, but these events are entitled Conversations. So before we get started, we'd like everyone to introduce themselves in the chat box. Add your name or company and where you're joining us from. We want you to get used to using the chat box because this is also where we want you to place any questions that might come up throughout this conversation. We'll get through as many of these questions as we can during the Q&A at the end. And as a reminder, this is a public event, so please avoid disclosing any personal medical information when using the chat feature. We're recording the session today as well. It'll be available on the Check It Challenge website and the American Heart Association's Eastern States YouTube channel. You can access all of these materials on the event website, www.heart.org/checkitNY, or checkitny, I should say. If you're using social media throughout this conversation, please use the handles that you see on the screen at AHA New York and #CheckIt. So our first speaker today is Dr. Cynthia Jones. Cynthia Jones is the Chief Medical Officer for Mosaic Health. Mosaic Health is a network of federally qualified health centers in the Finger Lakes and the Mohawk Valley regions. She also practices at Mosaic Health Center in Utica. Dr. Jones serves on the board of directors of the Rescue Mission of Utica, as well as Compassion Coalition. She's a member of the New York State Cancer Advisory Council and president of the board of the American Heart Association of Greater Utica. She's a member of the American Academy of Family Physicians, and she's also a member of Alpha Kappa Alpha Sorority. So Dr. Jones, thank you for joining us here today. First, we can get started off by, can you share with some of us the basics on blood pressure and your perspectives as a board certified physician?
So basically, first of all, what's hypertension? What is this? So hypertension, I think of it when you have a hose, a water hose, And if you step on it, it's hard to get the water through. And that's kind of like your heart trying to pump against those hardened arteries in the blood vessels. And that creates high blood pressure. The definition of a great blood pressure is less than 120/80, but no lower than 90/60. So anything above that is an issue. Anything below 90/60 is also an issue.
Mhm. And why is blood pressure so important?
So, it's important because it's risky. You need to know what your blood pressure is. If you're in that sweet spot of 120/80, 90/60, you're great. But if it's too high, there are risks of heart attack and stroke. If it's too low, there's risks of fainting and dizziness. So it's important to know your numbers. You really need to know what your number is.
Yeah. And there are all kinds of risk factors, obviously, with all of this. So what are modifiable versus non-modifiable risk factors and conditions that are associated then with high blood pressure?
Yeah, so modifiable risk factors are well, let's go with the non-modifiable ones first, because that's what you got to really deal with.
Yeah.
Your family history of hypertension, it is what it is. Your age, it is what it is. For example, if you're age 65 and a woman, you're more likely to have hypertension than men. So gender counts as well. Your race, African Americans, Hispanics, Asians have higher rates of hypertensions, and chronic kidney disease, which can be genetic as well. Things that you can change or modifiable risks are physical activity, your eating habits, such as sodium. You're gonna hear a lot about sodium, I keep saying it. Your weight, intake of alcohol, treating sleep apnea or snoring. That's important to get that treated. Monitoring your cholesterol, controlling diabetes, smoking, big one, including vaping, monitoring stress levels as well. We'll talk a little bit more about that.
Mhm. Do you want to talk a little bit more about stress levels right now, since you just mentioned
Wow.
it?
So, so people, we think about heart attacks, strokes happening during times of stress, but that's not the only time that that's when it's at its top game. But those small stressors during the day also elevate your blood pressure. So it's really important to really monitor your stress levels, know what you can and can't take, have your times when you're walking away, when you're doing your mindfulness activities. Those are important even throughout the day to
Yeah,
help control your blood pressure.
good advice and reminders for all of us there. Can you address, we talked a little bit about this in the intro, the disproportionate rates of hypertension in Black and Indigenous communities, as well as people of other ethnicities?
So 55% of Blacks have hypertension, often develops at an earlier age. For Asians, 46%. For American Indians and Native Alaskans, it's about 33.5%. Latino, 40%. I mean, these are high. So these are communities that we really concentrate, and the Heart Association focuses on trying to make sure that we connect and educate, because that's the key thing. Some of the reasons that this is happening is lack of access to medical care, the cost of the medications themselves, and I can talk about that a little bit too, and lack access to healthy foods, living in a food desert where there's no healthy food.
Mhm. Yeah. What can uncontrolled hypertension then lead to? What are the risks?
So if you don't control it, and first you have to know what it is,
Right.
to know that it's controlled or uncontrolled. Heart attack. It can lead to stroke. It can lead to vision loss, kidney disease, even if you don't have a genetic underlying kidney disease, heart failure, even sexual dysfunction can happen as well. So the risk, if you combine these with, like, if you have uncontrolled hypertension with diabetes, everything gets worse. Uncontrolled hypertension with kidney disease, your outcome can be worse. So those are the things, if you combine all those things together, it's a problem. So you need to know what your number is.
Yeah. You touched a little bit before on stress and ways to manage your stress throughout the day when you have those little moments of stress in our newsroom, we call them like micro panic attacks. So as a physician, what is the one thing you recommend everyone on the webinar today do to work towards blood pressure control?
Um, one of the things that I recommend is I thought about this and I talked to my staff about it. It's like, be honest. I mean, really, it's really being honest. So regarding your risk factors, make sure you talk about your family history. You got to know, or else you can't change things. Know your actual blood pressure. Get a cuff, ask your provider to give you a prescription for a cuff. With your primary care provider, be honest about your symptoms. If you're having chest pain or shortness of breath, let's talk about these things. Let's talk about your risk factor. If you need help with weight loss or stress management, it's okay to say, I need help with this. I can't do it on my own. If you can't afford your medications, let your provider know there are lots of ways that you can get help. And if you're having side effects from your medications, don't just stop them. Call us. Let us know this is going on. There's tons of medications to treat blood pressure. There's a lot of options that we can do. In the end, we're just trying to walk this walk with you. So we can do it together with honesty, openness, and looking at all the options that are best. They're going to be best for you. There's always something we can do.
Yeah, that's a really good reminder because I think a lot of people are so nervous to speak up oftentimes. So
Yeah.
good to
Yeah.
keep in mind. Dr. Jones, thank you so much for all of that, for all your insights. For everybody on the call here, if you have questions for Dr. Jones, you make sure to put them in the chat box. We'll get to them in our Q&A session later. And we're going to move on now to our next guest, which is Dr. Natalie Powers. So Natalie began working as a pharmacy clerk at Kinney Drugs in Clayton, New York when she was just 16 years old. From 2011 to 2014, she worked as a pharmacy intern at Clayton while attending Albany College of Pharmacy and Health Sciences. Upon earning her Doctor of Pharmacy in 2014, Natalie joined Kinney full-time as a pharmacist, covering various stores as needed before becoming staff pharmacist in Alexandria Bay, New York. Natalie was promoted to supervising pharmacist in April 2015, a position she held until her promotion to medication therapy management pharmacist in September 2021. In May 2022, she was again promoted to supervisor of medication therapy management and clinical operations. That's the position that she holds today. Natalie and her husband Adam live in Clayton, New York with their two sons, 5-year-old Grady and 3-year-old Graham. They enjoy boating and camping on the St. Lawrence River and being active in their community. So Natalie, welcome. It's great to have you here today. And thank you to Kinney Drugs Foundation also for their continued support of the Check It Challenge. A pharmacist, as we know, can play such a critical role in managing and controlling blood pressure. So what role does the pharmacy actually have in controlling blood pressure?
So first of all, it's such a pleasure to be here today. Thank you for having me. And as a pharmacist, I feel like we're generally the most accessible healthcare provider. So in retail pharmacies, when you walk in our stores, we're readily available. Our faces are there. We're ready for questions. We don't charge a copay, or you don't have to schedule an appointment for our advice. So we like to be a part of the medical team as kind of a go-to healthcare professional, both for your medical and medication advice. In addition, we also have access to check your blood pressure at the pharmacies and ask questions, and we can help solve medication-related problems and provide strategies to improve your adherence to medications as well.
Yeah. It's estimated that 3 out of 4 Americans do not take their medication as directed, which is really alarming when you think about that. So what are some of the barriers that people face and how can they be mitigated?
Yeah, so of course, taking your medications as prescribed is so important to helping lower your blood pressure. Some common barriers that patients face include drug interactions, possible pill burden, like they're like, I don't want to take another pill, affording some of the medications that can be prescribed depending on your insurance coverage. And some patients don't feel like they want to take their medications if they think that they're feeling good that day. So I think that those are definitely barriers that pharmacists can help with. We can talk to patients about cost-saving options or medications with maybe less side effects or drug interactions, possible combination blood pressure medications to decrease that pill burden. If they're taking 3, maybe we can give them 2. One of them will be a combination of the 2. And really, honestly, the most important part is the importance of taking that medication, even if you're feeling good. So we also offer automatic refill programs where we can say, we can help you. You don't even have to call your refill in. We'll fill it for you. We'll make sure we have it in stock so you never run out. So that is barriers and ways that we can help with those barriers.
Yeah. If hypertension doesn't really have any signs or symptoms, it's tough. How do we know the medications that were prescribed are actually working?
Absolutely. So the best way to know if your medication is working is to check your blood pressure regularly. Like Dr. Jones was talking about earlier, that's really knowing what your baseline numbers are, taking it, keeping a log, keeping track of what your readings are, is really the most important way. So there's also at-home blood pressure monitors. They're very easy to use. Many insurances can cover the cost of these, and you can ask your pharmacist for recommendations to ensure that you're getting a quality monitor. I really recommend avoiding maybe the finger monitors and the wrist monitors, as they may be less expensive, but they also tend to be less accurate. We really like the arm cuff blood pressure monitors. They've come a really long ways. A lot of them are fancy. They hold memory for one or multiple users. They can share, or they can save and help you keep track of your readings. So yes, we're here for you to help you choose that if you want to have one at home, which we would highly recommend.
Just out of curiosity, because I've never looked into it, and I'm sure some people might want to know, like, how much roughly does something like that cost?
Yeah, there's a wide range. If you want it to hook up to Wi-Fi and email you your results, you're looking at $100. But if you're looking at just a simple blood pressure monitor, you could probably get one for the $40 to $50 range.
Gotcha. Also, most pharmacies have BP kiosks available. So, what can people do to get the most accurate reading?
Absolutely. So most pharmacies, they'll have a blood pressure kiosk right in the pharmacy. So when you get to the kiosk, we want to remind you of a couple things. So you don't want to, usually the pharmacy is in the very back of the store. So you're walking all the way to the back of the store. So don't sit right down, be out of breath, try to take your blood pressure. We want you sit in our waiting room, get comfortable, let your heart rate come down, relax before immediately checking your blood pressure. You want to try to keep both feet on the floor and don't cross your legs. And you want to avoid talking while taking your blood pressure. Just try to sit there and have a couple minutes of peace and quiet and take your blood pressure. Our kiosks are calibrated frequently as well, and they're very accurate machines. So if your reading comes back low or high, then you certainly want to take the time to discuss that with the pharmacist.
Yeah.
Also, if you happen to be checking your blood pressure at home instead of on a kiosk, we recommend checking it at the same time every day and writing down your readings so you can share those with your physician.
If you get a reading that does concern you, I'm assuming you can also, ask the pharmacist to recheck it and make sure that you're doing it correctly.
Absolutely. If you're ever at a pharmacy kiosk and you have any questions about your reading, please come ask us. That is what we're there for. I love when a patient comes up with the receipt with their blood pressure, even if it's perfect. I'm happy to talk to them and tell them, good job, or is that normal? That looks low to me. What is your blood pressure normally reading? But if we feel like that reading isn't correct, most pharmacies have either a manual cuff or a second form of a blood pressure machine behind the counter. So we might say, you know what, let's sit down, wait a few minutes, and we're going to check it with this device. So we have those options as well.
Gotcha. When taking blood pressure medication, is there anything that people should avoid or do?
Yeah, so taking high blood pressure medication is important in controlling your blood pressure, and you might have to take more than one medication for best results. Like Dr. Jones said, there's a lot of different options out there. Finding the right drug, dose, or combination might take some time, so you have to have a little bit of patience with these medications. Some of the medications might make you feel a little bit tired when you're first starting them. So you want to be patient with your body, give your body time to adjust, continue taking that medication unless these side effects are incredibly bothersome, of course. This phase could last a few weeks, but it's always important to consult your pharmacist before taking over-the-counter medications as well. You might not think twice, but medications like anti-inflammatories like ibuprofen or nasal decongestants like Sudafed, they could possibly raise your blood pressure or interact with your medications. So we're also there for you to help choose a medication that's right for you that doesn't interact with your blood pressure medication for other conditions.
Yeah. I mean, you're just talking about juggling multiple medications, but do you have any suggestions on helping to remember to take your medications or what else we can do to better juggle all those meds?
Absolutely. So this is like our specialty as pharmacists. Oftentimes I will be on the phone with a patient who is overwhelmed at their pill burdens, and I will say, bring them in, grab all your vials, bring them in, or sit down at your counter and call me. And I will tell you, we'll make sure that you're taking them the right time of day and that there's not interactions between two of them. So, we know it can be really hard to keep track of your medications. We can talk to you about pill containers and different ways that might work better to help you organize them. Taking your medications correctly is essential to good treatment. Your pharmacist can also touch base with you regularly, ask how you're managing, and give you encouragement too. Recently, I lost one of my favorite patients. I think he was close to 100, but he would come into the pharmacy every single morning and he would march to the blood pressure machine and he would sit there and he would take his blood pressure. It was always perfect. And he only did it because he liked me to tell him, good job, Ron. Like, your blood pressure is amazing. Like, he loved it. He had lost his wife. He was just like a lonely, sweet old man. And so I absolutely loved it. So the moral of that story is we're here for you. We're your community pharmacist. We're here in ways far beyond just dispensing you your medication. So don't hesitate to contact us with any questions. We can help you set timers, fill a pill box that works best for your regimen, help you create a blood pressure log, and so much more.
Yeah, that's really good to keep in mind because I don't think that most people even think about all the things that you guys are knowledgeable in and that we could turn to you for help as like another resource with all this stuff. Once you are on blood pressure medication, is it possible to get off? Yeah.
Yes, that's a great question. It's certainly possible to get off of medications, but generally is going to include making some lifestyle modifications. Medicine isn't going to fix it, and then you can stop it and go back, to your normal life unless you're making some of those lifestyle modifications. So, reducing weight generally can reduce your blood pressure by about 5 to 20 millimeters of mercury, depending on your BMI. Exercising 30 minutes daily is associated with a reduction of 4 to 9 millimeters of mercury, and reducing your sodium intake can affect it as well. So in addition, moderating your alcohol intake and having a diet that's rich in fruits and vegetables and low in fat can help as well. So we suggest making small changes at first to help make a firm commitment by making these lifestyle changes long term for you. And the most important thing to remember when it comes to blood pressure medications is to not stop taking them abruptly. If you are to discontinue a blood pressure agent, we generally will want to wean you off of this depending on which class of medications you're taking. And this is going to require some professional guidance. Sudden termination of any of these medications can lead to rapid or dangerous blood pressure elevations. So we just want to let our patients know how important it is to not stop taking something or don't let yourself run out of these medications.
Yeah. What are some of the most frequent common questions that you get about blood pressure medications?
Yes. So when someone's initially prescribed a blood pressure medication, we see the majority of questions. They're nervous about taking a medication that's going to lower their blood pressure. So we get, like, how is this working? When should I take it? Do I have to avoid things like driving or exercising? And what's the side effects going to be? Should I avoid certain foods like milk products or grapefruit juice? What if my blood pressure gets too low? Like, can I do something about that? So these are all questions that we're happy to help answer. And it really depends on what medication you're actually prescribed for your blood pressure. Um, as I stated earlier, though, we are accessible 7 days a week, morning to evening. So don't hesitate. You don't have to even come in. You can give us a call and say, this is how I'm feeling. Is this normal? So being informed will help you understand really the importance of remaining adherent in making these medications work and making a big difference in your life.
Yeah, such important information. Natalie, thank you so much. Really appreciate hearing from the pharmacist point of view here. And again, a reminder for everybody who's tuning in, any questions that you may have, you can put them into the chat box. We'll get to them later. And now we're going to move on to our next guest, which is Lori Napoleon. So Lori is a Western New York native, born and raised in Genesee County, now resides in Niagara County. Lori is a registered nurse and received her Bachelor of Science degree in nursing from Niagara University and a Master of Science in Nursing from the University of Phoenix. Lori is currently a community impact director for Buffalo, New York, working on the CVS Health Equity Focused Hypertension Initiative. In this position, she assists community-based organizations in obtaining and placing blood pressure kiosks in settings throughout Buffalo, focusing on underserved populations. In addition, she works with healthcare organizations to provide linkages to care for community members in need. Lori lives with her husband, Mark, in Lockport, New York. She has 3 children and 6 grandchildren. They all live in the Western New York area. Lori and her husband co-founded the Michael Napoleon Memorial Foundation in memory of their 8-year-old son, Michael, who passed away from Burkitt's lymphoma. The foundation assists other families with the challenges of a pediatric cancer diagnosis. So, Lori, welcome. Thank you for being here today. It's great to have you. Thank you for all the work that you do. Can you start off by telling us what self-monitored blood pressure is and why that's important?
Yes, first, thank you for having me today. It's a pleasure to be here and to be able to share this knowledge. So, self-blood pressure monitoring refers to regular measurement of blood pressure by a patient outside of a clinical setting. So that could be at home, or like the pharmacist said, Natalie said, taking it at the pharmacy on the machine, on the blood pressure kiosk machine. And the benefit is it really helps doctors, physicians better monitor and manage your high blood pressure. And it helps patients take an active role in monitoring their own treatment and blood pressure. So based on what Dr. Jones and Natalie have both said, it kind of just really aligns with the better we are able to monitor it, the better we're going to be able to control it.
Yeah, it's so important to know what's going on kind of in your own body. And how often should people be checking their blood pressure?
So an individual who gets diagnosed, if they're giving a self blood pressure medication, blood pressure cuff, I'm sorry about that, self-measured blood pressure cuff or equipment to use at home, we recommend that they take their blood pressure twice in the morning, a minute apart, for about 7 days. And then again, twice in the evening, 1 minute apart for 7 days. Now, if they can't manage it for 7 days, if we get a consistent readings for at least 3 days, that's a good gauge for the doctor to be able to say, yes, maybe the medication's working. Yes, it's under control at home, but maybe it's just something that happens in the doctor's office, things like that. So, and we do use that 1 minute, take it a second time to ensure the accuracy, because sometimes your blood pressure can fluctuate. Sometimes you're very anxious the first time, might help you to kind of relax a little bit for the second reading. And again, we want the most accurate readings that we can possibly get. So we can gauge, again, treatment. Is it working? Is it not working? Do we need to change something? So a couple other things that were mentioned by Dr. Jones as well as Natalie was keeping a log. You want to monitor your readings carefully. You write the date, the time, the reading. Those are things you want to refer back to your physician. And then besides having a self-monitored blood pressure cuff at home, there are places like the pharmacy. We already talked about that, but one of the projects I work on personally is providing blood pressure kiosks throughout the community of Buffalo. And so we're working with community-based organizations, and we're putting them in a variety of places. Now, some areas have blood pressure cuffs in the library, and some of the libraries also do loaner programs. So something to think about, or something to ask your library if it's something they do. We also, in these community-based organizations, have kiosks. They're just small blood pressure kiosks that are centered in various locations. They vary from, we have one in a small market here. And as people come into the market, they're able to take their blood pressures. We're trying to meet people where they are, so they have more access to this equipment and are able to then, again, monitor how they're doing with their blood pressures. It's also good if you are starting a new, say you're already on medicine or starting a new medication, that you monitor your blood pressure, regularly to see, again, is it working, is it not? Because just like Dr. Jones said, you do not want to, you want to prevent those risk factors from heart attack and stroke.
Thank you for all that information.
Okay, sorry.
No, you're
kinda got
fine. You're fine. I wanted to talk too. What is the importance of all this? Why is there a benefit to knowing what your baseline is?
Yes, your blood pressure is a primary indicator of cardiovascular risk. So if you know your numbers, you'll know if they're up, they're down. Later on in this, we're going to show you a chart that will identify what is a risk, what's higher, what's low, and what things that you should be looking at. But again, knowing your baseline, you'll know if it's elevated, if it's lowered, and then the doctor, your nurse practitioner, whoever your provider is, will be able to evaluate first if treatment is working, and as well as how are you doing? How do you feel on this medication? So,
yeah. You kind of talked a little bit about the best way to check your own blood pressure, but once you've kind of figured that out with the 2 times in the morning, when should you then talk to your doctor?
okay, so, well, a couple of things too. The best way to check your blood pressure at home is using a validated blood pressure cuff or device. So I wanted to mention that first, and I know there's a link inside the chat for validatedbp.org, and that's what I'd recommend if you were going to purchase one at home. And when should a patient talk to their doctor? So they should you should always check that your reading should be consistently about 120/80, and if they are above 130/80 consistently, we kind of say that's an alert. We need to, this is consistently high. I need to see my doctor. She's going to provide the chart. There you go. So if you look at this rainbow chart in the green, those are the norms we love. We want you to be in that range. And if you look as we go down into the rainbow colors, once you hit the orange 130/139 or 80/89, remember it's a upper number and a lower number, systolic over diastolic. So anything that is above that consistently is now considered high blood pressure stage 1 or hypertension stage 1. Then as you go down and as they get into a little bit of higher ranges, 140 or higher, then we have stage 2. And remember, the higher the blood pressure, the higher the risk. So we want to make sure that we're, again, using the medications, using them consistently, talking to your pharmacist, talking to your physician, and having that good dialogue with both of them to be sure that things are staying under control. Now, the bottom level hypertensive crisis is when the blood pressure gets higher than 180 or higher than 120 on the bottom. Now, that is when you want to seek out immediate treatment. And many of these, you can, we'll put this in the chat, but you can also find this online. American Heart Association has many, many resources for this. So after you start a medication, you should inform your doctor of any new symptoms if you're lightheaded or dizzy or any other changes that are concerning to you. But those are the numbers you want to look at.
Gotcha. And we talked a little bit about this as well, and I know you mentioned the link, but if you want to just hit that again, how do we find a reliable blood pressure monitor?
Okay, so we recommend if you're purchasing one, the American Heart Association recommends validatebp.org. And again, it is in the chat. Those are physician approved, and they do provide the best accuracy and measurement. And if there is, even if there's a loaner program in your community, utilize those devices if you don't have any other options, even if they're not on that device list, but you want to make sure that you're taking it But if you want to purchase one, that's the site that you should go for. Also, ask your doctor or your pharmacist for any other resources that might be in your community. You might not know where a blood pressure kiosk is located, and it could be next door to your home, in another pharmacy, at a store. There are some at the barber shop. So it just depends on what community you live in and where they're accessible. So
Yeah, that's good to point out because I'm just thinking I've never noticed it in any stores or pharmacies, but I've probably walked by it 1,000 times and just never realized it was there. So good to know. Lori, thank you so much for all of that information, for
thank
chatting
you.
with us today. Appreciate it. This is time for Q&A, everybody. So if you have any questions, feel free to shoot them into the chat here. While I have you, Lori, here, one thing is I'm getting a question, is one number in the blood pressure reading more important than the other?
You mean the systolic over the diastolic?
Yeah.
They're both important. And if you look at the two columns, it'll tell you, you look at the first column will be the systolic and the second column will be the diastolic. But if those numbers are falling consistently on either side, I would talk with your doctor.
Gotcha. And then I guess this can happen. What if you're normal with one number and then not with the other?
Again, consistently high on either side, I would talk to your physician.
Okay.
Okay, they can better determine if it's something they're consistently seeing that's elevated, that they may want to treat. It would depend on, and again, they're going to look at other risk factors. Sorry about that. They're going to look at other risk factors as well. You know, does this person have a heart history, history of heart disease in the family? Does this person have a history of stroke in their family? And they're going to look at those risk factors in addition to just the readings.
Gotcha. Dr. Jones, Natalie, was there anything else that you wanted to add in relation to those questions before I move on to the next one?
I think Lori covered everything that I would have said as well.
Awesome. The next question I have here is, if you're making lifestyle changes, is there a way to know when it's time to come off of high blood pressure medication?
I think that's when I said if it's too low. So that's why you need it's nice to have your own cup. And I think Lori said it, Natalie said it too, most insurances cover it. You just have to ask your primary care provider to write a prescription for it. So usually it's covered. You can get one at home, but if you're feeling lightheaded, dizzy, don't always assume my blood pressure medicine isn't working. It may be working well, and you know what? You met your goals. You did what you're supposed to do. You got rid of that sodium, you lost that weight, you cut that stress, and it really did make a difference. So now you need to get it checked. So if you're falling below 90/60, or even in the lower normal where you just don't feel right, call your primary care physician. So there are providers, so they can come in and say, okay, let's take a look at this. Maybe we can cut back on one of these meds, or change one of the meds, or decrease the dose of the medication. But whatever you do, we've all said it, don't just stop. Call.
Yeah, no, that's good advice. Lori or Natalie, either of you want to add to that at all?
Well, I think Dr. Jones hit it on the head.
I agree. I agree.
Okay.
We do have patients, where they might just have, it's too low for them. They're used to being 120/80 and now they're 100/70. They're having dizziness, and then that can lead to other problems. So absolutely, just call your primary care provider if you're feeling off, is what I would mimic with Dr. Jones.
Yeah. Do you have any advice for what to do if your doctor's office has you standing or talking when you're getting your blood pressure checked, which you should know from this webinar that that's not the way to do it?
Well, I'll pipe in here. There is a lot of people are rushing into their physician's office, or they're having a stressful day or whatever. They really need to sit down for a good 5 to 10 minutes before they even think about taking their blood pressure. Now, if they're rushed back into the doctor's office for, just for time's sake, and how doctor's offices can be very busy, they need to think about, and everyone on this webinar, sit down, Make sure your bladder is empty, feet should be on the floor, your arms should be at level on a surface. And if your blood pressure reading is high when you're at the physician's office, it should be taken again before you depart from the office, or, to be sure that it is something just caused from the stress of rushing and getting in versus, you know, that you really do have something wrong with your blood pressure.
Dr. Jones, how does sodium cause high blood pressure?
Yeah, so sodium, the enemy, makes stuff taste good.
I
So
know,
there's
we don't want to hear that. We all
I
want
know,
our
like,
pretzels and our chips.
you need just enough so it's not bitter. So sodium causes you to retain water, and that causes more fluid retention, puts more pressure on the pipe. So imagine, you've got a small pipe and now you're trying to shove all this water down there. That's more pressure. So it's interesting. I like the times when, not that I like it, but it's a teachable moment when somebody comes in and they just had something wonderful for lunch, their favorite food, their favorite salty food, and I take their blood pressure properly, sitting, let them sit, talk, chit chat for a while. We actually have the proper way to take it on the wall, so patients know this is what we're doing, and the blood pressure is high. And then, like, the be honest conversation happens. So what happened? Either they rushed and take their meds, they oops, I had, yeah. And so it does affect the blood pressure. Those are teachable moments. I'm like, okay, see, this is what I need you to know. I felt a little funny. That's right. I had a headache. That's right. So those are teachable moments.
Mhm.
And I think what Dr. Jones said earlier, it is so important to be honest with your physician. You don't really
Yeah.
want to say, oh, well, I'm not having any sodium and I'm exercising every day. If that's not the case, we want to help. The practitioners want to help, the pharmacists want to help, the doctors, but you also have to help yourself to be sure that you're following that regimen. It's very serious. It's really important.
Yeah. Would medication treat low blood pressure as well?
So Natalie, you can answer it, or I can, but
I was just about to say, there
go
is
ahead.
medication, so that's a whole different topic, I would say. So this high blood pressure, tons of medications to treat your high blood pressure. If your blood pressure is getting too low from high blood pressure medication, we would just back off or adjust what you're taking for high blood pressure. But if you're just baseline have low blood pressure, then there's certainly a different conversation to be had about medications and treatments for a low blood pressure at baseline.
Gotcha. Those were all of our questions. So thank you to everybody for sending those in. Thank you to all of our panelists here for answering them so well. So yeah, thank you to our amazing speakers and the sponsors that you see on the screen for making the Check It Challenge possible. Again, thank you to today's presenting sponsors, Baxter and Kinney Drugs Foundation. And last but not least, thank you to all of you in the audience, as we mentioned, for joining us today and for those great questions. And keep this in mind, your registration from this event gives you access to all future webinars in this series. So the next Check It Community Conversation, How to Eat Better and Manage Health, will be on Wednesday, March 26th, also at noon. And we hope to see you there. In the meantime, keep checking your blood pressure. Let us know how you're doing. You can tag the American Heart Association at AHA New York on Facebook, Instagram, and Twitter using the hashtag Check It. So thank you, everybody.